Okay, let's start the class, and this will be a very roughly review class for the exam 2. You definitely need to study really hard. Okay, Thursday there's no lab, so you have to study hard, and because it's a lot of information if you never studied it before. So the exam format will be similar to this. At the beginning, we will put lots of the bacteria. Now, obviously, those bacteria we have been taught in the class. Then we'll have a case study, or some very short answer, or short questions, and you pick from that. And also, that could be duplicated, or multiple times use the same bacteria. It's not like it's gone, you can delete it, okay? Because different bacteria may test you in different scenarios. So let's look at the question. Okay, John, an English instructor at the university, received a call from adult daycare, okay, where his 74-year-old mother was staying. That means it's older people. She was experiencing chest pain, chills, and had a fever. So this is a symptom, chest pain, chill, and a fever. When he arrived at daycare, she seemed to be short of breath and cough, and had the morning has worsened and become productive coughing. The local hospital prepared a sputum sample, which grown blood agar and chocolate agar have alpha hemolytic. The gram stain revealed numerous white blood cells and numerous gram-positive diprococcyl, and the catalase test negative. And the Optican test find it sensitive to it. So, which passaging is that? Okay, this is giving you some of the information. This is alpha hemolytic. This is number one. Second, this is gram-positive. Just to remind you, please do not talk in there. Because I have a complaint with some of students, like exam 1 reviews, there's lots of people talking there. Please don't talk. If you already know, you feel free to whatever you do by yourself, but please respect all the others. Because I believe lots of the people need to listen. Okay, because it's an exam. Okay, this is gram-positive coccyl, diprococcyl. And then what they find, this is sensitive to Optican. And this is a P-disc. Is that right? Remember, this is P-disc. So this is the characteristics of what you did for the test. And then what you find that the symptoms is chest pain, have a fever. So, which passage is that? That's community-acquired ammonia. So it's Streptococcus pneumoniae. So that's the information what we got. Okay, so the answer is Streptococcus pneumoniae. Now, I will highlight all the important information related to this bacteria. Then you will get to know what is important. Another one, this is catalase test positive. So we know catalase test could be differentiated. Staphylococcus and Streptococcus. Staphylococcus is positive, Staphylococcus is positive, Streptococcus is negative. Okay, so with this question, there is lots of the information you can write on the side or on your notebook. This is for you to study. So that's the first one. Second one, a mother brought her 4-year-old boy to the regional hospital. He had a headache, tough neck, and a sore throat. So what this tells us, tough neck, headache, that could be meningitis, very possible. And you could not look at the lights, complain it hurt to see lights, that's called photophobia. Then the boy had a fever and appeared sleepy. And chest exam and the radiograph was normal, but because of declining mental status and history, headache and photophobia, a lumbar puncture was done, which showed 32 white blood cells. So gram stain, cerebral spinal fluid was performed. Arabic culture blood agar, chocolate agar, find it's only grow on chocolate agar. Okay, and the patient has not received child vaccination, and also they run the XV test like that. So you can see surrounded XV, the bacteria is there. Which pathogen is that? So this is we talk about the child, and this is meningitis. And the meningitis we talk about, there is age dependent. So 0 to 2 months, this is GBS. 2 months to 5 years old, this is type B, Haemophilus influenza. 5 years to 40 years old, this is what we call, it's a very special bacteria cause the meningitis for adult and also the undergraduate students. It's Neisseria meningitis. And the last one is older people, is Streptococcus pneumoniae. So, this is a meningitis, and this is 4-year-old, has a fever, and also we mentioned this is a fastidious bacteria. Fastidious bacteria, which means not on Macanthi agar, not on blood agar, and only on chocolate agar. That's the only thing grown on chocolate agar. And remember, this pathogen needs a very important XV factor. X factor is hemming, and V is nicotinic adenine nucleotide. We're going to talk real quick next week. This pathogen is grown there. Look at the picture there. So, which one is that? It's a typical symptom for type B Haemophilus influenza. So this is how we solve the problem, okay? And these information you should write on the notes at the space of the practice exam. Okay, question number 3. On Monday, January 29th, a 27-year-old female office assistant experienced a sudden onset of dizziness while at work. The lady was carried to a co-worker's car and began to vomiting, complaining of a severe headache, muscle aches and nausea. The lady was taken to the hospital where her condition worsened. She claimed she had not feeling very well all morning and presented with a temperature of almost 3 degrees Fahrenheit. She developed a rash and experienced a sudden drop in the blood pressure. Okay, what they did, blood and the CSF was negative for sepsis and the bacterial meningitis. So, sepsis, which means the blood in the bacteria in the bloodstream. Her history was significant in that she was experimenting with a new conjunctive sponge that has not been removed since the previous evening. So, what is this? This pathogen, this example here is typical TSST1. And the symptoms what this lady has is toxic shock syndrome. So, which pathogen used for that? And typically we see the white highlighted description is a new contractive sponge. Obvious is that was possibly using the period of time. So what is that? Staphylococcus aureus. Is that right? That's what the thing we talk about, Staphylococcus aureus. It's related to a highly absorbent tampon because they absorbed all the liquid, then the normal bacteria is gone in the vagina tract, and the Staphylococcus aureus is dominant there. So, this is an easy one. Okay, next question. Number 4, a gram-positive coccus was isolated from a 37-year-old female UTI, urinary tract infection. We talk about this in the lab. Laboratory tests indicate the organism grown blood agar with no hemolytic zone. Catalyst test negative, serological typing belonging to Rebecca Lansfield group D. So, this is go back what we talk about. Rebecca Lansfield group what we find is group A, that's Streptococcus pyogenes, and group B, Streptococcus agalactiae, and the group D, what is that? Enterococcus facilis. And from here, it has UTI, it belonging to Rebecca Longfield group D, so obviously it's this guy, Enterococcus facilis. And this is one I write on the blackboard somewhere, okay? So this you should be familiar with. The results is obviously. And also it says catalyst test negative because Enterococcus facilis long time ago belonging to Streptococcus. So it has a similar characteristics to Streptococcus. It is catalyst test negative. Okay, so that's an easy one. A 22, lesson number 5. A 22-year sexual activity woman, female, comes into the student health clinic complaining of painful and frequent urination, dysuria. So that's the terminology for dysuria we mentioned in the lab. The technician spun down her urine for microscope observation and find gram-positive coxal in grape-like cluster. So what this tells you, if gram-positive coxal in grape-like cluster, it is very possible, looks like Staphylococcus. And the Staphylococcus further testing revealed the organism was catalyst test positive. Yes, we mentioned here, Staphylococcus is catalyst test positive and resistant to novel vaccine. And I said all the time, there is one bacteria, Staphylococcus, sexual transmitted disease could cause. Is sexual active young girl, and this joke will tell you the mom and the nurse will find it very easily because it is resistant to low dose novel vaccine. So what is that? That's a honeymoon bacteria, Staphylococcus saprophyticus. Is that correct? So you pick from the Staphylococcus saprophyticus. Okay, let's go talk to here. 29-year-old pregnant female elected to have home delivery using midwife. So that's home delivery, home birth. She chosen to have little medical intervention, delivered a healthy 7-pound baby boy. On day 5, postnatal, the baby was experiencing tremors, vomiting, and this is called tachycardia, abnormally rapid beating of the heart. He refused to breastfeeding and had a fever and 102 degrees Fahrenheit. His urine, cerebrospinal fluid, and blood was cultured. The blood culture and the CSF came back positive for gram-positive, catalyst test negative, and beta hemolytic. Considering the age of the patient, which pathogen is most likely, and they isolate resistant to basic tracing. So which one is this? This is the newborn baby. It's beta hemolytic. Beta hemolytic for newborn. And what are you going to see? It's resistant to basic tracing. And the basic tracing we're using for the A disc. So what is that? In the A disc we have two. One, remember we talked about the A disc? If this is A disc, this is basic tracing. We have one is resistant. We have one is sensitive. Which one is resistant? GBS, is that right? That is GAS. So what is GBS? Streptococcus agalactiae. Okay, that's very simple. This one. Okay, a Honduran mother and a 5-year-old boy across the United States stopped a freight train from Mexico, but were apprehended by U.S. immigration authorities. Shortly after being placed in immigrant detention, the boy developed a sore throat, difficult swallowing, and onset of neck swelling. So that's a bull neck. A blackish-green membrane exudate was developed. So there's a cedo membrane on the tonsil area. A swab was collected, and the gram-stain with gram-positive and a club-shaped arrangement. And the culture on the blood agar was terrorite. The patient, the history was significant in that he did not receive childhood vaccination. So, this is the one, yes, we are talking the first day of the class. We have a bull neck. And what else we have? We have cedo membrane and the grayish on the tonsil area. And there's a vaccine for that. What's the vaccine? They should do it. The vaccine, what they should do is DTaP. That's diphtheria, Clostridium tetanus, acellular, and the Bordetella pertussis. And they don't have a vaccine yet. So which one is that? And more important, they already tells you this pathogen is gram-positive club shape. So what is that? It's Corynebacterial diphtheria. Okay, very important is Corynebacterial diphtheria. So that's question number 7. Okay, this one is easy. From your pathogens list, which organism is the most common post-surgery infection and belonging to antibiotic resistance known as MRSA? So we talk about the methicillin. So what is MRSA means? This is everybody knows. This means methicillin resistant to Staphylococcus aureus. So that's the answer, is Staphylococcus aureus. We mentioned Staphylococcus aureus is a food intoxication. It is MRSA. It is toxic shock syndrome. Is that right? So we mentioned about these reasons. You can write there. It is food intoxication. It is TSST1. It is also MRSA. So those are the 3 things which has happened for Staphylococcus aureus. It is important you get to know about that. Okay. In Yavapai County, Arizona, a 13-year-old boy in the 8th grade was culturally confirmed positive for pertussis. Okay, that's very important, the pertussis. And had attended school during its illness. To identify others who may be infected, a probable clinical confirmation was established for the other students in that middle school. What are the criteria for clinical confirmation? Okay, this is mentioned. What is this disease? We already talked about this is pertussis. So this is Bordetella pertussis. And during the class, we talk about the Bordetella pertussis. What we can do is using nasopharyngeal specimen and followed by PCR testing. And remember, we also draw a picture of the person with nasopharyngeal. We go to the nose, this has to be the half distance depth of the nose to the earlobe. And we also mentioned the swab is not a cotton swab, it is Dacron swab, because research conducted by University of Utah has been showing using Dacron swab could be better recover using PCR methods. Okay, so that's called Dacron swab using PCR methods. Okay, so the answer here is B, positive polymerase chain reaction of nasopharyngeal specimen. Okay, question number 10. The culture-based screening methods for the prevention of the systematic GBS infection recommend, and I said when we talk about the GBS, group B Streptococcus agalactiae, the important information is the pregnant woman at 35, 37 weeks of the pregnancy has to do a screening test. A screening test, otherwise a newborn will have meningitis, septicemia, and all those type of the disease. So that's why the C is the answer here. And this one we already said. The approximately distance you should insert the nasopharyngeal swab is half distance from the nose to the earlobe. So the answer is C. Okay, from the pathogen list, which organisms are now considered part of the United States recommended childhood immune schedule? So we can go ahead to see all of these. Streptococcus pneumoniae, is that included? Yes. Okay, let's look at the others. M, let's look at M. Haemophilus influenza, yes, it is. And then we look at O. Yeah, Corynebacterial diphtheria, yes. And Bordetella pertussis is yes. So the answer here is C. So for example, from A, you look at L. What is L? Yeah. Staphylococcus saprophyticus, there's no vaccine. We hope they have. People think they have. I make a joke before. All these sexual transmitted diseases, there's people wish they have a vaccine because they can do whatever they like. So, but we don't have it, unfortunately. That's why it's a social problem or a medical problem. There's a debate about that. Okay, and then you look at the other choices. D, for example. Viridem streptococcus, no vaccine, because that's a streptococcus in the oral cavity. So obviously those are not. So what we have the vaccine, streptococcus, ammonium, Haemophilus influenza, Corynebacterial diphtheria, Bordetella pertussis, and we don't have here, which is Clostridium tetanus. Those are we have the vaccine. Some others we don't have it. What etiological agent is responsible for childhood vaginitis, tonsillitis, sinusitis, otitis, and superreactive skin infection, and the sequela will be rheumatic fever and glomerulonephritis. And this is the one we talk all the time. This is the one will cause strep throat. And the sequela, which means disease followed by the recovery of the original disease, it's rheumatic fever and glomerulonephritis. That is Streptococcus pyogenes. That's group A strep. Okay, so the answer is D. Okay, here is the thing. Of course, you need to know the correct answer. But whenever you have the answer, you need to know why this is the answer. This is the answer. And when you have talk about Streptococcus pyogenes, you go back to look at your after-class reading. And those are the information what you're going to be collecting. Okay, you don't have to worry about the spelling, because it's all information in the top, you only pick from there. Okay, so that's the first set of the questions. So I'm going to be just take it out. Okay, second set. This set, I really like this one. If you haven't done any study yet, I would encourage you to do the exam to review first, because this is short answer. And when you get from here, A short sentence, you get a warm-up, and then you go to do the case study, which is easier for you. Okay, so let's talk about these. Number one, can grow bioacetylene agar, hydrolyzed carbon hydroacetylene. Okay, this is what we mentioned. Which one? Enterococcus facilis. This is grow on bioacetylene agar, and it will show black colony because acetylene and becomes acetylene, and it shows the black colony, a reduced of the salt. So what is this one? Enterococcus facilis. That is it. Can produce toxic shock syndrome by elaborating a toxin referred as TSS1. This is we already talked. One of the case of Staphylococcus aureus is for TSST1. We already talked. Number three, pathogenic forms of may produce beta-hemolysin and the enzyme of coagulase. So remember, in the classroom, at the end of the first class, I draw on the blackboard right here a table, which is talk about all the Staphylococcus. And the mannitol salt agar, you're going to go back to look at that one. Mannitol salt agar, we mentioned about the coagulase. We mentioned about novobalsin, hemolytic. And which one here mentioned the coagulase test positive? It's Staphylococcus aureus. So the answer is Staphylococcus aureus. And it's beta-hemolytic, it is beta-hemolytic also. Okay, next one. Catalyst test negative, okay, we know it's Streptococcus. Gram-positive cocci, belonging to immunological group A, that's group A strep, and susceptible to bacillus tracing. Okay, this group A, Streptococcus pyogenes. So that answer is A. Next one. Alpha hemolytic gram-positive cocci. Catalyst test negative, okay, strep, sensitive to bile salts. Sensitive to bile salts, which means it's not this guy. Because this guy is resistant to bile salts. This one is not. To the bile salts. And other surface actives like optican. Optican is the components of P disc. So what's that? It's Streptococcus pneumoniae. And we can see these. Okay, and the sensitive. Variant Streptococcus are resistant. Next one. A gram-positive cocci, that is catalyst tested positive. Okay, Staphylococcus. Coagulase tested negative. That's not a Staphylococcus aureus. And resistant to low concentration of novobalsin. We just talked about that. It's a honeymoon bacteria, Staphylococcus saprophyticus. Next one, can grow and ferment lactose or macanthi agar more than one. Okay, this is the one we talked about a couple of times. What is that? E. coli and Klebsiella ammoniae. And if you look at the picture, you will see the Klebsiella ammoniae, which is ferment lactose or macanthi agar. So this is what you have to do. You need to go back to look at your slides also. So let's go back to slides. If you forget, okay, we can go here and we talk about these things one by one. And you don't forget, we mentioned about here, this is Klebsiella ammoniae. On the left side is a macanthi agar. It's a cheese-like milk-coiled colony because of a heavy capsule. And you see the pink color there because lactose fermentation positive on the macanthi agar. So that's Klebsiella ammoniae. That's why we say it's more than 1 ounce. Okay? That is just for you to review. Exam only have one correct answer. It's for you to review. This microorganism can grow on selected media containing 7.5% salt. Does not coagulate rapid plasma and is susceptible to novel bouncing. Okay, susceptible to novel bouncing, containing 7% of salt, does not coagulate rapid plasma, coagulates test negative, susceptible to novel bouncing, on selected media contains 7.5% salt. So what is this one? Epidermis, Staphylococcus epidermis. Okay? And this one is also possible. Enterococcus facilis. Possible. So you pick either like E and F, both are fine. Possible. Because 7.5% salt, also this pathogen will be resistant. Okay, belonging to a group of alpha hemolytic microorganisms that normally live in the upper and cause optimistic infection. Alpha hemolytic. Which one? Which is alpha hemolytic? Normally in the cause optimum. Ovarian streptococcus. It's alpha hemolytic. A gram-positive inospore found in the soil, that's bacillus. That's obviously, it's Bacillus subtilis. We talk about it in the lab all the time. Okay, so question number 10. These gram-negative lods grow rapidly on blood and chocolate agar, producing milk-cold colony fermentation lactose or McConkey agar. Which one? We just showed you. Calabacilla ammonia. Okay. Question number 12. Fastidious bacteria grow on BG agar. Okay, you don't have to worry about this one. This is Haemophilus influenza. I didn't mention BG agar, so you can forget about it. Okay, question 12, you can forget about it. 13. The etiological agent of whooping cough. Which pathogen causes whooping cough? Bordetella pertussis. And the vaccine, DTaP. Next one. Gram-positive lots that's forming palisades arrangement. Which one has palisades arrangement? Gram-positive. Club shape. Corynebacteria diphtheria. Okay, next one. Gram-negative lots that grows on chocolate agar, not on the blood agar. Okay, it's a fastidious bacteria. Then cause meningitis, epicolitis in age 2 months, 5 years old. Type B Haemophilus influenza. Okay? Next one. Responsible for toxigenic disease that produces a thick greenish pseudomembrane in the back of the throat and lymphedema pathy known as bull neck. We just mentioned the Corynebacteria diphtheria. The HIV vaccine for this pathogen. What is HIV? Type B Haemophilus influenza. So that's Haemophilus influenza. The DTaP vaccine contains a toxoid to prevent which pathogen from causing this disease. This will be a multiple choice. So the list here, what are they? Corynebacteria diphtheria, Bordetella pertussis. It doesn't have a cross-fit in it. Okay? Let's next one. A gram-positive catalase-negative coccell that belongs to Langsfield group D. Right here. Enterococcus facilis. The last one. Can infect the skin and cause impetigo and deep cellulitis. Okay, when you see this, we already talked. I wrote on here the skin surface impetigo, cellulitis, like a bee house underneath the skin surface, sequela, rheumatic fever, glomerulonephritis. You should know this one very well. Streptococcus pyogenes. It's group A strep. Okay, so I would suggest you, if you never studied, go to do this setup first. Then get a warm-up. Okay, we finished these two. Then let's look at it. Practice number 3. Okay. Okay, let's look at some of the questions. I would be jumping into the question right here. It's a case study. This mainly focuses cross-treating. Because remember, we talk about all the others, then we're spending a lot of time talking about the cross-treating. So, this is the list and the others. Let's go these one by one. June 22nd, the 4 people attend a coconut fundraiser for the local, was hospitalized 24 hours later with difficult swallowing, double vision, and slurred speech, difficult to speak. Neurological symptoms. Many patrons of the event recall some level of mild stomach upset in the later evening of the event. That's food intoxication. It is significant to know that many of the dishes were prepared by local individuals from home canned goods. That's important. And laboratory data from the fruits served at the event demonstrated gram-positive, large shape, subterminal endospore, anaerobically, and from a canned yellow tomato dish. So I'll just go here. What is most possible? It's canned food, anaerobic endospore-forming bacteria. Which one? Clostridium botulism. It's a very typical incident happens. Okay, next one. June 15th, 17-year-old female, normal state of good health, developed a fever for several days. No localized symptoms except for a large circular rash on her back. Okay, that's a very good typical symptoms, circular rash. History was notable, and 3 weeks earlier she had spent a weekend campaigning and biking on the Saddle Hollow train in Mammoth Cave National Park. It's in Bowling Green, Kentucky, an hour north of Nashville, Tennessee. Okay, it's a fun place. Her blood was cultured unsuccessfully, but presented with antibody type 32, typical spiral sheet disease. It's a spiral sheet. The technician decided to view the blood specimen under the dark field microscope. So which one? Okay, we say spiral sheets, we mentioned 3 things: Treponema pallidum, Borrelia burgdorferi, and Leptospira interrogans. And this one have a circular rash, spiral sheet disease using dark field microscope. This is typically, yes, Lyme disease. So which one? Borrelia burgdorferi is the answer. Okay, that's very typical symptoms for Lyme disease. Okay, 2010, Warren County, Kentucky, identifies 31 person has diarrhea visiting a beef cattle operation in Warren County. And generally the symptoms, hemolytic uremic syndrome. Now you don't have to worry about this one. I haven't talked about this yet. I mentioned a couple of times. What is this one? Beef cattle operation, hemolytic uremic syndrome, and the grown macaque agar, lactose positive. It's E. coli, 0157H7. Okay, we haven't talked about detail, but I mentioned it, but we'll talk about detail in the exam 4. Next one. 60-year-old male was admitted to the hospital. 5 days post-stat surgery, complaining of dysuria, and a qualitative quantitative urine was obtained, reviewed E. coli is there. Okay, the physician placed the patient on a 7-day course of ceftriaxone. Okay, that is an antibiotic. The urinary tract infection improved, but the patient has multiple watery loose stools, cramping, abdomen pain, and dehydration. Then had an AB test, returned positive. And what they find is pseudomembrane colitis was unsuccessfully treated with antibiotic therapy. And the fecal transplant has happened. These are the important information. Okay, well, this means a pathogen caused by using antibiotics too much, too dramatically, and has water bloody diarrhea, and the pseudomembrane colitis, and have to use, and after failed typical antibiotic therapy, and the fecal transplant has to do, which means very severe. So which one? It's Cadiv, Clostridium difficile. Okay, so the answer is Clostridium difficile. Okay, let's look at this guy. Blood agar plates can use for growing the anaerobic bacteria that cause gas gangrene. Well, that's a very good one, gas gangrene. The organism was isolated in the bile bag anaerobic system and displayed typical hemolytic response and is characteristics of this disease. What hemolytic response and what organism is this for? This is double beta hemolytic zone and also cause gas gangrene. So which one? It's very typical Clostridium perfringens and double beta hemolytic zone, Clostridium perfringens. Okay? Okay, now let's look at the other questions. What's the difference between food infection and food intoxication? We don't need to write it anymore. What's the difference? Food infection, you're eating bacteria. What's the example? E. coli 157H7. Food intoxication, you're eating toxin. The onset is very quick, 6 hours. What is the example? Staphylococcus aureus. Okay, second question, how we cause the decay? So teeth, what happened for the teeth? So you eat, like daily taking too much of the sugar. And what's the sugar there? Dextrin. And dextrin will be fermented. And what's the bacteria there? Viridine streptococcus bovis. So feel the biofilm. So it's difficult to do the oral hygienic procedure. And during the fermentation, what kind of products generate? Acid. Acid, what they do for the animal? The animalization. So causes decay. And for this question, a very typical slides which is provided to you. So you should absolutely take a look. Which is now this guy, which is right here. I believe is right here. That's the answer. Sucrose and the plaque formation. Is that right? That's what we talk about. Streptococcus mutans, the dextrin, in the microaerophilic or anaerobic environments, they're going through fermentation, generate lactic acid, and then going through the demineralization process for the animal and cause a tooth decay. So that's the plaque formation. Okay? Okay, botulism and tetanus toxin. What's the difference? What are 3 types of the botulism? This is easy, we talk about. Yes, food botulism, infant botulism, and wound botulism. We talk about that. Those are 3 different types. Okay, what is the difference between botulism and the tetanus toxin? We also have a slide to describe that. This is the answer. Is that right? They talk about the botulism, tetanus toxin. What's the difference? Because the botulism toxin blocks acetylcholine, so no contract. It's always relaxing. It is always contract. Sorry, and then when you have the tetanus, there's no relaxing. It's always contract. So we'll have the lock jaw because it blocks the signal of glycine. That's for relax. So this is slides provide you answer for that question. Okay, Vibro. How the Vibro cause dehydration related to CMP? And what type of the food? Jellyfish or any type of the seafood. What's the mechanism for that? That's a story of the coral, how they're going to find out. Is that right? Because they activate, the enterotoxin activate adenine cyclase, and this creates CMP, they block uptaking of sodium, and then they increase sodium chloride in the lumen jaws in the water, and the excessive water comes out, and generate rice water stools. So that's coral. Okay, Lyme disease is spread by mosquito, of course not. Which one? Lyme disease. Ticks, eiderduck ticks. Yeah, so the answer is false. So the disease caused by Streptococcus mutans is dental decay or caries. We talked about already. Okay, Shigella. Which one will cause Shigella? Daycare kids will cause Shigella. So the answer is B. Why are many diseases of the gastrointestinal tract not treated with antibiotics? Why? We mentioned about the development of the penicillin. Penicillin V, penicillin G. What is the hurdles to use that? Is they could be destroyed by the stomach acids. So, why many diseases of gastrointestinal tract are not treated with antibiotics? Because destroyed by the acid at pH of the stomach. Is that right? Yeah. The primary treatment for the chloral. What's the chloral going to do? Lose all the water. So what's the primary treatment? Put the water back. So we call rehydration. That's D. Okay, this is a match. What are we going to do? Okay, so we're going to see the answer, okay? Let's see. Let's see these also, how are we going to do? Block transpeptidation reaction in cell wall synthesis. That's penicillin. We know. Okay? Inhibit DNA gyrase activity. Okay, which one? Rifampicin. Okay, then we see. Disrupt membrane transport and the functions. You can only use it on the skin surface. That's it. Okay, we have 3 left. Then you have to see then what you're going to do. You can only guess, I believe. So what are we going to do? Okay, go back to see slides. Now you're going to go back to see slides. Will be... okay, by the way, you don't have to worry about this guy. Okay? This, we're not going to test you here. Okay, this control, I didn't test you here. It's too much because you don't have to worry about that one. Antibiotics right here. Did I hear? So, tetracycline, what's the function of tetracycline? Chlorophenicol. So you go back to here. What is for tetra? Blocks tRNA binding to the ribosome. Is that right? Tetracycline there. Okay, that's good. That is E. What is on the left? Inhibit RNA polymerase, transpeptidase of the blocks. What does it left? B and D. Which one left? Chlorophynical. Is that right? So that will be chlorophynical. So that's B. So which one left? And that's D. Okay. So that's how you do these questions. This is what we talked about, the food, wood, and the infant. Three types of botulism. This is what we already talked. Okay, let's see here. June 12th, June 2012, USDA FSIS announces that it is taking new steps to fight E. coli, protect the safety of the American food supply. To the best of your knowledge, what steps are being taken to protect the American food supply? I didn't talk about that. 6 additional serological typing will be there. So we're going to talk about this in the exam 4. Okay, so you can skip that one. Who is the first person to find the penicillin? Fleming. That's easy. Is that Fleming? Okay. Chemotherapeutic agents that are natural products of microorganisms that are most specifically referred to, what they call it? Is that called antibiotics? Okay. That are artificially produced, that's called antimicrobial agents. So what are the things we're going to talk about here? We're going to talk about something right in the middle, right here. Is that right? Chemical synthesized antimicrobials. If it's coming from produced by microorganisms, it's antibiotics. So the answer is right here. The lowest concentration of an antibiotic that prevents growth, minimal inhibitory concentration. That's what we talk about. That's why we have so many methods right here. Kirby-Boer test, E-test. That's all for minimal inhibitory concentration. E-test, what is that? It's not for virus, absolutely. It's not for SQLing. It's a qualitative antibiotic sensitive test. Use plastic strips impregnated with an antibiotic of interest. So it's B. Okay. The most selective antimicrobial agents are those that interfere with the bacterial cell wall synthesis because of what? Because cell wall have a unique structure not found in eukaryotic host cells. Okay? That's easy. Sulfamates and other drugs inhibit the folic acid synthesis have a high therapeutic index because why? Humans do not use folic acid. Humans do not synthesize folic acid obtained from the diets. It should be B. Is that right? Same as a microorganism. We don't synthesize folic acids. Otherwise, you don't have to take it. Okay, vancomycin. Remember, vancomycin we talk about, it is an alternative way to do the treatment of Clostridium difficile. And we're using penicillin too much, so we're going to using vancomycin. So what we do? What's a vancomycin going to do? Okay, how we do that? What's the answer? Inhibit the transcriptase section independent biosynthesis. Our abbreviation is not B. Inhibits transcriptation reaction peptide biosynthesis, blocks the addition of chain during. Okay. Which one? Can you read? What's a vancomycin? Binding to the amine amino acid chain, interference with peptide glycan synthesis. So which answer is the best? What do you think? What do you think of this one? Yeah, the C is good. That's it. Let you think about it. You never heard about A. Last one is not. And this is not for the lipids. Okay, so this is we finished. Okay, so we finished all these things. Don't forget one thing. Don't pack up right now. Haven't done yet. And don't forget what we have is after class reading. You should read it. Is that right? That's what I said. These things you should read. Don't pack right now. It's important. What we have here. Case study. Right here, case study, exam review. I'm not going to make fun for you. That's need a review. Okay, then look at that. 2-year-old admitted to hospital with massive tissue destruction, right arm. The skin is violet color, fluid filled blisters. Okay, the patient had a fever, rapid heart rate, low blood pressure, seems confused, recovered from checkbox. This is important. And on the areas have become infected, gram-positive coxal in the chain.